You're listening to the Autism Weekly podcast. Each week we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Erin Kang, an assistant professor at Montclair State University, whose groundbreaking research bridges science and practice to improve autism interventions. We're also thrilled to welcome Dr. Sadaf Khawar, a postdoctoral researcher whose award-winning work focuses on the barriers South Asian and Middle Eastern North African families face in accessing autism services. Together, we'll discuss how cultural and structural factors shape access to care and share practical advice for families navigating these challenges. Welcome to the podcast, Dr. Erin Kang and Dr. Sadaf Khawar.
Thank you so much. We're happy to be here.
It's my pleasure. And we've talked about cultural issues in the past on our podcast, but I don't know that we've ever truly focused on the South Asian or Middle Eastern, North African population. So I'm interested to learn about that. But I have a feeling is that there's going to be so much overlap that we can learn, and that is a little bit more generalizable to almost all populations as we talk through this to make sure that nobody's left underserved. But before we go there, I'd love to give a little bit of background to our audience on, what inspired our guests to take the journey into where their careers have taken them and the advocacy work that they're doing. So maybe, Dr. Kang, we can start with you, and you can give us a little bit of a background of what inspired you to focus your research on autism, and particularly in understanding that clinical presentation and in developing interventions.
Yeah. So I think it goes back to when I was in high school. I really had a special connection with the boy who was interested in my socks more than anything else, but really struggled to make friends with his peers. And I really didn't know it at the time, but he was autistic. And so as I later began sort of my studies in brain and behavior, and also along the way building connections with other autistic individuals who are actually really unique and different from the boy I had known in high school, I was really motivated by these experiences, and these experiences really guided my work to focus on understanding this diverse clinical presentation of autism. So led me to study clinical psychology, and also really focus on examining a lot of these various factors that underlie these differences. Some of them are dispositional and individual differences, but others could be things like cultural factors, right? And really using that insight to refine and innovate effective evidence-based interventions.
Yeah, and I would imagine over time is that not only did your perspective change as far as being kind of educated and being able to learn more, but probably your perspective of the experience of that individual is that you can reflect back on that to be like, now I might have a better understanding of what was important or what drove that individual to care about those specific items in their environment, or to have that very specific interest. Is there something that, like, when you think back now, where it's like, gosh, I wish that younger me was able to put that into perspective?
For sure. And I think my own experience of really being not knowledgeable about what even autism is and why autism might, drive this child to act in certain ways. I think that was really sort of key moment for me to, okay, maybe I really need to do better as a professional in this field to increase awareness, and even to high school students or younger children to increase awareness and to promote more inclusive environments, right? And I think that was a key moment for me. Okay, I really didn't have any insight back in the day. So what can I do more? Or what can what kind of work can really support, a boy like the child I had known to, be happier and have better quality of life. Yes.
Yeah, no, I find it amazing. A lot of people share that same experience when they're trying to figure out the field that they are hoping to be able to go into, and they see a passion like that, and it drives them to so much wonderful research, so much wonderful work. But on that research side, is Sadaf, I'd like to just kind of understand, because your focus with South Asian and I guess the Middle Eastern North Africa, I guess I'll refer to that as the MENA. Is that
Yeah,
correct?
absolutely.
Families, is that it's probably a group that, because there has not been a lot of independent research on that, we're making assumptions as clinicians way too frequently with. But what led you to say, hey, you know what, there's barriers. There's barriers to access to care. There's barriers to understanding families and providing appropriate health care. What led you to say, I want to focus on this?
Mhm. Firstly, thank you for having us here. It's a pleasure. And that's absolutely right that there are barriers and the fact that these groups are understudied. And I want to highlight a very, very significant point, which was one of the main points that led me to pursue research, was that South Asians are one of the fastest growing groups. Over 5 million people in the US, and more than 75% are foreign born. Ironically, despite this fact, we don't have a separate racial category in the US Census. So whenever there's a research study and there's a demographic form that families complete, they are pretty much grouped together as either Asian, mainly Asian, I would say. There's no South Asian category. Same for the MENA community, where very recently they have been added to the census, but then most of the research, they're either like white or Asian. So I think that is one of the main inspirations, I should say. But other than that, I think it's also my positionality as a South Asian American who came to the United States as an immigrant, and over 20 years now, my journey and interacting with people as a BCBA, as a clinician, working with families at the grassroots level. I realized that there's a lot of work that needs to be done, specifically, if, when it comes to like culturally responsive care. And if
Mm-hmm.
clinicians like me, who are from a specific community, who have that sort of cultural congruence, are able to sort of pursue research so that I can create some awareness, I felt that it's like something that would be very, very important. And I think at this point, it's not optional. It's actually
Mm-hmm.
essential to focus on such work.
Yeah, I think that you can do as much harm as good if you're not identifying some of those important cultural factors that should be guiding, especially in behavioral health, mental health care, where it's so much of a core of our belief systems and who we are as people. So what are some of those challenges? And maybe we'll start with you, Sadaf, and you can give us a little bit of an understanding. But what are the challenges if we don't really understand the culture and separate and instead generalize care as one bucket?
Absolutely, yeah. So one of the things is that a lot of the care, specifically when we are servicing families with autism, parents, caregivers, like the whole family system ends up being an integral component. It's not just the child that we're focusing on or the individual. It's in the family system. So all the more reason, and a lot of times when specifically if we talk about ABA therapy, for example, or early intervention, it's happening in the home setting.
Mm-hmm.
So if there are providers going into the home setting, there are language barriers. There's like sometimes clear lack of understanding of how to integrate culturally tailored sort of interventions in the home setting, just because there's certain cultural norms that are not understood.
Mm-hmm.
And families historically have felt that they're not understood as well. So they've felt that sort of they've internalized that, and that is a big hindrance in building rapport with a clinician. So
Yeah.
at the very get-go, when there's no trust there, then you can well imagine how much of buy-in a family would have for any type of incredible tools that anyone would be introducing in the family. So it's a very important point to sort of consider.
Absolutely. And Erin, I mean, you've seen the history of how families and practitioners have worked. And I mean, over time, if I were to go back and think about 15, 20 years ago, I'm putting myself in a place where, the science was what guided everything. It was a very pejorative care model, and everything was focused on the research, which was done on a very specific population of people. And it was pushed into homes and saying, this is the way I need you to live your life, instead of realizing this is what's important to you as family. What does that create in that family environment? What is it that is, I couldn't imagine being in a situation where somebody's coming in and telling me what should be important to me and how my child should be raised. Is this part of that health disparity that we're seeing?
Definitely, yes. So health disparity can mean several things, right? But I think really, as you mentioned, sort of it could include lack of culturally competent care that we are right now touching upon. It could mean financial or language barriers, but also it could mean stigma and lack of awareness in families and different perspectives of viewing behavior or understanding the condition, right? So, and I think health disparity definitely combined with all of these can lead to delayed diagnosis that really lead to fewer access to services, intervention hours, more unmet needs that the families are faced with, right? So I think, yeah, really there are multiple layers of health disparities, right? But in terms of families' perspective, right, like when they experience, at the, individual level with the therapist or interventionist, like there may be this disagreement or distrust of providers, but also systemic issues, which I think we'll hopefully go into a little bit more. But really, all of these interacting together to get in the way of accessing services or receiving more satisfactory, interventions, difficulty getting consistent care. So I think all of these are really big issues related to health disparities.
Absolutely. And you started out by talking about diagnostics, and I'd love to hear a little bit about where maybe cultural differences have created an underdiagnosis of specific mental health problems in the past, or even an overdiagnosis where it's just kind of looking at, well, this particular child is demonstrating some behavioral issues, so I'm going to put them in a bucket that says that they have a social emotional behavioral problem, where it could have been something like autism, or it could have been something like ADHD, but because of their cultural background, I've grouped them into this bucket, which is more of a prevalent diagnosis. Do you see that there's something wrong with our tool, or is it something wrong with our bias that's leading to some of this?
That's a really excellent question. And I think Dr. Khawar might have some research to support these points, but I think it's really combination of those factors, right? So there historically a lot of research has been done on sort of specific population and really overlooking diverse groups that exist. And so even our understanding of autism, and then also tools that we use to understand autism, there may be a lot of biases and underrepresentation of different racial ethnic groups. And so, but also there are biases, as you mentioned, in terms of, if this is a behavior we see in, let's say, a certain group, then maybe viewing it in through a different lens, I think, is another contributor. And I believe Dr. Khawar has some research to support those, differences.
Yes, for sure. So we just want to give background as well a little bit, that typically symptoms, or for autism that we can actually see, it's around 12 to 14 months. But research has shown that families might wait up to the age of 3. Just because, again, I would like to highlight here that providers have something to do here as well, where parents specifically in my recent research have mentioned that it's the minimization of concerns, primarily at the medical provider level, that basically led to the delay, where initially they were just dismissed. It's okay, things will be fine. This is a boy. Boys might sort of, develop differently in certain aspects or something, just as one example. But the average age of diagnosis, as per research, is between 4 to 7 years, which is pretty delayed compared to when initial symptoms are seen. For example, in the African American community, kids are historically diagnosed later, and one study did reflect that up to 1.5 years later than white kids. And you can well imagine when there is lack of diagnosis, that means that the family is not getting services, because a lot of times a diagnosis of autism is a compulsory component before any type of ABA therapy, for example, can be. This is pretty much consistent across states. So overall, as we can see, when we synthesize all of this, such reduced access to early intervention is causing critical developmental delays, which again, it's a cycle. Right.
And you have the opportunity you work within the pediatric department within the university that you're doing your research, which is one of the first touch points. I mean, when you're looking at what the American Pediatric Academy is recommending, is that those screeners are starting early. They are the ones who should be guiding the process. Is it that they're undervaluing some of the parental communication? Is it the fact that parents aren't communicating to their practitioners? Where's the miss? Because it seems like, they're told screen at these times, get the information at these times. What's driving that?
So it's a bit of different factors here. One thing is that even though firstly, we have to understand that a diagnosis of autism is a very comprehensive process. A screener can just give us an idea. It could be a false alarm as well. It could just sort of not understate what the actual clinical presentation for a child is. So the screeners are not the evidence-based or what we call the gold standard autism evaluation. They're like these, as you know. And I think one biggest factor here that I recently, as being part of a medical center in the US, is long waiting lists. That even if a child meets maybe checks positive on a screener or a brief checklist, the time of that red flag to the time of actually getting the evaluation can sometimes be up to 2 years. So you can well imagine that even if a medical provider is doing their due diligence by referring the family for a full evaluation, that evaluation is not going to happen. So there is a dearth of providers, I feel, which again, and then, another layer of that is a dearth of providers from, say, like culturally competent is another layer, and whether the system, wherever a provider is, do they have interpreters for the families? Do they have the right supports in the interim as the family is waiting? And again, that's a bit on a tangent, but the fact is there's several factors involved here.
But it's on the go ahead, Erin, but I'd love for you to also help us because it sounds like we touched on systemic concerns here, and I'd love for you to also elaborate on that this is one of them, is this piece that we're talking about as far as, is there access to a clinician thereafter? Is there access to all the other resources and services that you might have if you have finances or you live in a community that has enough practitioners of that culture? But can you help to kind of guide on that as well?
For sure. Erin, would you like to take that first? I want to make sure I give.
So I believe the question is like, there are, we just talked about sort of long wait list and difficulty accessing diagnostic services, but the subsequent steps, right? And I think in that process, again, culture and system really interact in powerful ways to really make families experience challenges, right? In both cultural ways and systemic ways. To elaborate just a little bit more, for example, as Dr. Khawar mentioned, for families whose primary language is not English, right? Navigating the healthcare or service system just to identify like available services, that could be a major challenge. And also cultural stigma, right? Different cultures might view different behaviors or autistic traits as differently, right? So these varied perceptions might make it a little bit harder to seek families to seek services in many communities. And then the point both of you mentioned earlier, really lack or limited nature of culturally competent care, right? So encountering healthcare providers who really lack understanding of the different cultural backgrounds, or again, going back to the biases that providers might have, like for example, like provider attributing a child's autistic behavior to, oh, it's just a behavior problem, or it's you know, it's a thing for this group of population, right? Rather than really understanding that as a developmental and neurodevelopmental difference, right? So yeah, inaccurate assessments. And I think all of this can really lead to families building some sort of systemic distrust, right? So this history of sort of being discriminated against or negative experiences, feeling like they're not understood by providers and healthcare system, really could lead to this sort of deep-seated mistrust, right? Again, that could make families hesitant to seek more treatments or follow through with recommendations. And I think that could also further widen this gap in care and leading to health disparities.
So even, Erin, as you were describing all that, I'm thinking about walking into a doctor's visit and just sitting down and doing just a basic interview with the doctor as far as them asking me questions about my child. There are so many variables that could come into play there. One of them is that if I am hesitant to speak in English because it's not my primary language, is that I'm not going to be able to always be able to share my message in the way that it needs to be understood. I also might not get the patience of the physician to sit there and ask the follow-up questions because it's a little bit more challenging when you're talking across two different languages. The other piece that I think would automatically hit me is the fact that some things that I would be experiencing in my culture as a norm or as a value might not be the same one that my physician is sharing. So how do we train? How do we help to coach? How do we educate? Where does this start for that physician network?
Right. And I think that's such an important and excellent question, right? And I think, as providers, right, I think during our training and education, like cultural competence is really underscored, but I think it really becomes really important when we start to really work with diverse population, right? And I would say, as much of a cliche it might sound, it really start from engaging in continuous self-reflection, right? To understand our own biases and sort of really by understanding how I am different from the diverse families we're serving, right? And actively seeking to learn from them. And, I think Dr. Khawar mentioned this to me, that cultural competence isn't just translation, right? I think she brought up a really important point about having interpreter or translator, but it really goes beyond that, right? So building trust and listening and adapting services, right? So understanding family values would be really important. And really showing that you care, right? To build that trust, right? I think is really important, and really inviting dialogue about cultural expectations and family values and how the family is understanding autism, I think would be really important starting point. And I think Dr. Khawar also had some points about cultural brokers, so I'll let her take on that point.
Thank you. Yeah. So I think so there are two parts here. One is as clinicians, how can we support families who are culturally, linguistically diverse? That's like one aspect of it. And the other is what can families do to sort of, support themselves essentially. So I'll first talk about what clinicians can do. So definitely understanding, going through anti-bias training, going through talking to people from specific cultural groups. It just cannot be understated. Have those conversations. If you have friends, if you have colleagues, do ask them very specific questions. Don't generalize that certain cultures have certain gender norms or something, and also understand what those gender norms are. Like, say in certain patriarchal societies, if there's a couple who comes in for a parent interview, and if the father ends up talking more than the mother, don't just assume that the parent who's not as vocal does not have a say in the household. Again, that's something we need to be very cognizant about. Maybe just that's the norm, where the male figure ends up communicating more in public or something. So it's, again, it comes down to the nuances in a culture. And specifically when we think about how what families can do is sort of really try to sort of bring together people like what we call parent advocates, or like we can call them community liaisons, who are familiar with the cultural background, as well as the sort of at the systemic level, understanding what the insurance company norms are, like how do we sort of what the formal systems are, what social services are available, what is a case manager, or above all, I think what specifically what the South Asian, MENA, and East African families that I've primarily worked with recently, one of the biggest things is families are not aware that there's a lot of support in the school system. So if it's an immigrant family who has just come to the US, the first point of contact, sometimes even before a medical provider, is the school. So the school systems have enormous amount of resources that can be tapped into, and I think that ends up being critical for families to sort of realize and understand, and that's where parent advocates come in really handy.
Yeah, and I think that when people oftentimes are experiencing that for the first time, is that the thought that you have to go battle for some of those services is not always a comfortable one. Is that you have to go in there and you have to be able to converse with an entire team and help them to understand that need is present and that it's something that we need to take care of, and that there's obligations to do that. One of the other systemic issues, and you had mentioned healthcare and you had mentioned payers, but one of the things that I immediately think about is that our healthcare system is set up where there's time increments. You have to get things done, move to the next person, and get things done quickly. Is that how do you, or what would you be saying to a family to help them realize that you shouldn't feel obligated to get everything out in a 15-minute pediatric visit? If you need more time, is that you need to make sure that you're getting that somehow. Or if you're doing a psych eval and you're saying, hey, you know what, this eval is going to take more than 4 hours because trying to be able to get all this information out of my child and to be able to empower my family, is that we need more time to be able to do that. But these caps that exist, I mean, how do you navigate that piece to it?
Yeah, I mean, I want to add again the cultural piece here, that a lot of times families, specifically from these communities that we're highlighting today, take providers as the authority, where they don't feel comfortable to really question the provider. So for example, if an office visit ends in 15 minutes and the parent barely started to make conversation, the parent will just leave very dissatisfied, and without realizing that they can actually advocate for for more time. Similarly, for evaluation specifically, I've seen families where it's a struggle to even get to the evaluation for like, which is oftentimes not just for one day. It's like typically over a span of days, average of 2 days. So imagine an immigrant family coming in, having more than one child, not having childcare, like who's going to be driving them there. So even to get to an evaluation, there could be transport issues that are not addressed. So these are all the multiple layers of barriers that are real and that exist. And again, the idea is for parents to somehow be made aware that you have these rights. You have sort of, options. You can call, say, county services for like transport support or something on those lines. And again, I think that having multilingual providers or providers who can sort of speak the same language, I think that is a huge, it's an understatement of how we just cannot emphasize how important this one aspect is, the language barrier. If we can overcome that, I think it opens up like avenues for families, and it changes the game and the future of a child's treatment overall.
Yeah. And having that language is a huge piece to it. And I don't think that anybody could ever be informed on every single culture to the level that is going to make them completely competent, which means that there's a family role on the ongoing process of educating providers on what they need out of this process. Erin, how does that work? How do families and providers work together to bridge cultural gaps? Because even in these cultural groups, there's differences. I mean, there's nuances that you have to understand.
Right. And I believe the best outcomes, right, happen when families and providers really see each other as partners, right? As Sadaf mentioned earlier, in many cultures, like there may be this sort of hierarchical relationship, like where families are viewed as recipient of care and providers are viewed as experts and they have the authority. And so I think we want to be able to sort of really address that issue, right? So really to bridge this gap, we really need to see providers and families need to see each other as partners, right? So open communication, mutual respect, of course, but again, providers actively listening to, and then again, seeking their expertise in terms of family perspectives, values, but also willing to learn more about cultural context. And I think, as you mentioned, it really should come from the families themselves, right? Rather than just, of course, like reading and other resources help, but we want to hear from the families on what their values are, what their lived experiences are, and they're really experts, right, when it comes to their child and the culture, right? So I think inviting them to share more, but also I think hearing about the family's priorities, right, in goal setting, and really decision making is shared between providers and families. And also I think, maybe even if we are not able to be trained in all the different culturally adapted interventions, really trying to align evidence-based therapy with family routines, right? Or with family values, or, really tuning into the unique perspective that the family is bringing in on top of these evidence-based approaches, I think would care really, effective.
Yeah, and when you're talking about evidence-based and you're talking about the ongoing treatment, so the diagnosis occurred, right now you're in a treatment model, whatever treatment model that might be. The research that is now starting to come out isn't always a cultural specific research, but more of an approach to being able to bring the family into care, the approach to being able to be a listening practitioner rather than a preaching practitioner. But what do you see the role of ongoing research? Is it about understanding the nuance of every culture? Is it about teaching practitioners how to be culturally responsive? Or is it a mix? And maybe Erin, you could start us off, and then Sadaf, you can give us a little bit more of a detail on what you're doing.
Yeah, for sure. And I think, as you mentioned, I agree. It probably is a mix of both. And so one sort of approach, sort of newer approaches in the field of autism research is something called community-based participatory research, right? So it's really this collaborative research process that equitably involves researchers and community members like families in all stages of the research process, right? So the goal is to combine knowledge with action. Again, viewing community members like autistic individuals, parents, other stakeholders as experts and really partnering together, right, to design studies or set research goals and priorities, and then also developing intervention as well. So I think that's sort of one approach, right? Community-based participatory research, that ongoing research, and we're seeing this trend in our field. So that's one area I wanted to focus on. And then the second is the implementation science, right? So we are trying to better understand how we adapt evidence-based practices to the diverse community context. And that's going to be done with these implementation science approach, right? So in the context of autism research, implementation science studies might show how to sort of effectively, but also sustainably, right, put evidence-based practices into place, right? So what are some of the factors that really impact the effectiveness of certain evidence-based approaches to be implemented to this particular community or cultural context? So is it adding on sort of different educational programs to combat stigma within that culture, or sort of incorporating cultural practices, right? And I think that's the way to make these evidence-based interventions have an impact in the real world settings like schools, clinics, and homes, right? So I think it's really, again, sort of bridging what we know about what works with what is actually being done in that context, so that the families and autistic individuals can really have access to these high quality care.
I love the thought on that. And Sadaf, before we get to the specific research that you're working on, Erin, I'd love to hear just a little bit more, because I've heard and I've actually seen in practice some of these community-informed practice approaches. And it's even changed the language that we're using within the treatment. So making sure that it's empowering, making sure that it's representing the values of those that are being served. What other pieces have you seen employed into a community-informed practice? Do you have specific examples that maybe within this community is that you were able to see that it's a large Latino community in the city of Nashville, for an example, and that particular population was able to share their experience to say, we felt like we were being or that I wasn't being represented in the treatment models that existed, or I wasn't being listened to. Do you have examples on maybe different cultures that have influenced the care within their community?
That's a really great question. Maybe I'll see if Sadaf has some examples she heard from her own research with South Asian and MENA communities. Well, I'll think more on that. Yeah.
So the fact is, like I mentioned in the very beginning, that we have big data surveillance studies that are trying to understand the prevalence across communities, prevalence of autism, and also how to measure early identification and all that. The irony is that, like I mentioned, we don't have those clear, distinct racial categories that would identify families who belong to certain groups. So what happens is that through advocacy from these groups, for example, the MENA community, now MENA is recognized as a separate category.
Mm-hmm.
And that's the first step to really see how communities, diverse communities who are fast, the population and their presence in the United States is increasing by the year, how they're included in research, which includes, like Erin mentioned, community-based participatory research. That's where stakeholders are involved, and that's like one of the most popular methodologies where it's really helping to promote neuro-affirming care in diverse communities because people are involved and they're able to have a say in what is important in terms of research topics, etc. as well.
Absolutely. And I mean, there's got to be a takeaway, though, when I'm thinking about I'm a family member. I'm currently in a position where I feel like nobody is taking the time to understand me or my unique culture or my background or my values or what I want out of my program. What would you be recommending to that family? Because doing the research is going to be so important to be able to inform practitioners in the long run how they can change their behavior, being able to inform schools on how they can be more inclusive, to understand that people are going to want different things out of the education or out of the treatment process. But there is that immediate need of, all right, I'm a family and I'm stuck in this right now and I don't know what I should be doing. What would you be giving to that family as far as advice to make sure that they are being heard as far as their cultural representation?
I would love to highlight here some incredible parent-led organizations. I think it's worthy of mentioning that, to your questions, that parents who were having very similar concerns did not find the right supports, and they have developed these institutions which now are supporting thousands and thousands of families. I'd like to name SKN Foundation here, which primarily is developed by South Asian parents, and altogether now it's targeting not just special needs, but a lot of other areas. Daru Sakina is another one in Houston, Texas, that is addressing the specific needs of Muslim special needs families, as an example. An incredible Ethiopian special needs society in the DMV area. So these are parents with concerns not being addressed, and they're like oftentimes immigrant families, and what they're doing is they have channelized their resources and all their struggles, and now all this entire incredible group of people is supporting more and more families. So my advice to families would be to connect with a local parent organization. There are lots of groups on Facebook. There are lots of groups on a lot of other social media platforms. Connect with them. One thing will lead to the other, is one thing. And also reach out to your local schools. Like, everyone has access to those, see what supports you have and recognize that you have the rights. Read up what the rights are, understand better what the IDEA Act is, what the ADA is, what are your rights. Like, every family has a right to have their IEP translated to a language that they speak. Do parents know this? Unfortunately, they don't realize that that's a right they have. So really recognizing that, and I think that the support as community liaisons from these incredible parent organizations can be a stepping stone to really understand better how to navigate the system, which might not directly meet their needs.
Absolutely. And Erin, do you have any recommendations for families that are out there as far as how they can make sure that they're not feeling lost in that system?
Yeah, for sure. And I think all the points that Sadaf mentioned, I think, are really crucial, right? Connecting with other parents, seeking advocacy groups, and really knowing their legal rights. I think it's really important. But also, we know that parents of autistic children are at a greater risk for mental health challenges, right? So really knowing that you're not alone, and again, really connecting with the right support, even if it's just other fellow families, right, who are navigating similar challenges, right? Really knowing that you're not alone, I think really important, especially, even if it feels really isolating and lonely, taking care of your own mental health too. I think that's one thing I wanted to, as a clinical psychologist, always want to highlight, like really taking care of one's, like, that metaphor of putting your own oxygen mask first before putting it on your child, right? That to add on top of all the important points that I've mentioned, trying to bridge the gap between research and practice, right? Science and practice. So, all the time that they're devoting to participating in research studies, it's really valuable, and we really cannot thank the families enough for their time and participation. And we're really hoping that the insights and sharing experiences and perspectives, that's going to really shape the future of autism research and practice. So I also wanted to sort of use this moment to like thank the families for participating in research, but also really hopeful that those participation will make meaningful changes.
Yeah, and it's that idea of being information is power, and paying it forward is that all the struggles that you might have experienced, you could be helping the next family to have a chance to avoid some of those pitfalls that exist in our care models. Sadaf, you wanted to add something as well?
Yes, thank you so much, Jeffrey. I just want to add a very important point. So as part of my recent research, I ended up interviewing a lot of families from the groups we're highlighting today: South Asian, Middle Eastern, North African, including East African groups. And the caregivers, the takeaway points are they shared two main lessons that they wanted to share with other families navigating the autism journey. And first, they said it was about mindset, where they advise like accepting the diagnosis, adjusting expectations around it, and staying resilient. And also what they highlighted was that progress can be slow at times, but that's the reality. And it's like, don't let labels define your child, and just remember that it gets easier with time. These are some powerful sort of statements by caregivers that I wanted to echo. And second, they said it revolved around action. Be your child's advocate. Push for early intervention and seek support without hesitation, because whether it's through groups, whether it's through counseling, as Erin pointed out, mental health for the parent is also very important and critical, or it's getting support from care coordinators overall. And the big takeaway is that be persistent, continue to advocate, and build that community with other caregivers, and then with time things will fall into place.
I love that thought process, and also the fact that it takes a village. So I mean, we've talked about how researchers rely on families' participation and rely on their voice and their honesty through the process to be able to help inform. We've talked about how parents can rely on the other support groups, the community groups, to be able to make sure that their voices get amplified. But I think that there's also that piece that the provider needs to be using both of these groups constantly to be able to inform their practice. And there's so many clinicians out there, and I know everybody's tired and everybody has so much going on, and even keeping up with the field is hard to do at times because it's still a young field in the treatment and the diagnostic space. So I definitely empathize with that, but the only way to get better is by having an open mind and open ears through the process. So Erin, where can folks go to learn more, whether it's about the research opportunities that are out there, the participatory issues or opportunities? Where can folks turn to be able to kind of make sure that they're a part of the process?
Yeah, and that's such an important question. And I think in recent years, we really have seen a lot of groups coming together, organizations coming together to really bridge that gap. So, and there are a lot of really excellent organizations that work to provide more resources to families and providers, and even organizations that match community members, autistic individuals who are wanting to participate in shaping research priorities, research questions, study design. And so Khawar and I would be happy to put together a list of those organizations, right, that people can browse through and not only get information, but find out ways to get connected. And that's really important point that there are, thankfully, we're seeing more and more really well-intentioned and passionate, motivated people sort of really working together to make exactly what you mentioned happen. So.
Yeah. No, and I think that is going to be an amazing resource. And I look forward to seeing that myself, because all of the changes that we've seen over time, they're grassroots changes. Somebody came up with a question that we needed to go and answer, and then the research and the funding followed that question to get us to be able to inform our practice, make ourselves better over time. So, Sadaf, what is the next big research question? I always love to see what's coming in the future. So do you have something on your mind?
Yeah, so I'm looking into telehealth interventions to increase accessibility, looking into specifically acceptance and commitment therapy based telehealth interventions for the caregivers in a family. I think that's really important. We cannot emphasize that enough, because there is a bi-directional relationship between parent mental health and child mental health, and we just need to address both. So definitely working towards that. And I want to take this opportunity to really mention that I'm also very keen to increase awareness, and as a clinician, as a researcher with my colleagues, of how to increase engagement from culturally and linguistically diverse families in research. Why is there lack of trust? The fact is there is. That's why they don't want to participate. So for that, I actually proposed as part of my research recent work is the ROBE model, ROBE, where I'm like, it's first, the R is like representation. Ideally, if there's a culturally congruent clinician researcher on your team, engage them, because that will help recruit more people. And then O is like offer ongoing support, which is tangible support. Don't just enter a community, selfishly to get your work done. What can you offer them so that will sort of be as if they won't feel used. And then B is like build trust. And then when you immerse yourself in the community, when you say are giving talks in a community, that automatically builds trust, and then maybe their caregivers are interested to participate in the research. And last but not the least, establish personal connections. Don't just call up a community center or a parent organization and say that I'm doing this research, I'll give you $100 gift cards. That is not enough. That can be perceived as insulting as well for families. So genuine engagement, I think, is the critical piece, where no matter what all these incredible research ideas we may have, we need to really respect the families that we're looking out to recruit, because without them, we cannot really continue with our work, basically. So that's my 2 cents.
Such wonderful principles. And I think that we should all be following those at all times. So I'm going to have to remember the ROBE model. It's new for me, so now hopefully I can live up to it. But Sadaf, Erin, thank you so much for sharing your experience and helping to kind of open our minds and start to ask the right questions, which I think is the biggest part. And hopefully it feeds down the line where then you all can go and start to research these questions and come back with some guidance for us over time. So thank you so much for coming onto the show, and I appreciate it. Hopefully we can bring you back after the next round of research has occurred and we start to see some of these changes in action.
Perfect. Thank you so much for having us. It's been such a pleasure to be on here.
Thank you very much. It's been an honor.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.